Hello everyone, welcome to Dr. Usman's EduTrends. How are you all? Hope you are all fine and doing great. Friends, as when we go through our middle age years, our proportion of fat to body weights tend to increase more, especially in women than men. Extra pounds of weight or fat tends to accumulate around the midsection. At one time, we might accept these changes as an inevitable fact of aging, but we have now been put on notice that our increasing waistlines can lead to many health risks. Abdominal or visceral fat, which is often called as belly fat, is of particular concern because it's a key player in variety of health problems, much more so than subcutaneous fat, the kind you can grasp with your hands. Visceral fat, on the other hand, lies out of reach within the deep abdominal cavity, where it pats the spaces between our abdominal organs. Regardless of our overall weight, having a large amount of belly fat increases our risk of cardiovascular diseases, insulin resistance and type 2 diseases, colorectal cancer, sleep apnea, premature death from any cause, and high blood pressure. To find out if you have excess fat in this area, we can use a measuring tape, to measure around a midsection at belly button level. More than 35 inches in women and 40 inches in men is too much or abnormal. Here are the few causes why this belly fat forms. The causes are there are several causes which contributes to the increase in belly fat. The main cause here is the association with the release of hormone called cortisol. Our kidneys have a pair of triangular glands called adrenal glands which releases adrenaline and cortisol. This cortisol hormone is the root cause of belly fat. It is often called as stress hormone. If stress is more, it will lead to more belly fat. We feel more hungry and start taking more and more food. So let us find out physiologically what happens inside the body and why cortisol increases belly fat. We need cortisol in optimum quantity so that it should not harm our body. If it is more, it will be problem where it will be increasing the blood pressure, increasing the more belly fat. It may cause less sleep or insomnia. Our daily lifestyle will be affected. Vitamin B will be very low, which leads to low immunity. More acid reflux will be caused and eye-related issues can start. Ultimately, stress will affect every organ of our body from brain to gut, heart, liver, etc. If it is low, it will be again a problem as cortisol has anti-inflammatory activity and it is very important in arthritis. WBCs are also maintained as adrenaline helps in maintaining immunity. It is an anti-allergic sometimes and helps in asthmatic conditions. It affects concentration power and brain. So our body demands a balanced release of cortisol. Our normal routine and normal life workload and lifestyle leads to slight stress and that is perfectly fine, as it is a regular pattern like increase and then decrease, then increase and then decrease. But if this cholesterol hormone is constantly increased and goes on higher side, then it is a matter of concern and leads to formation of belly fat. When cortisol hormone is released by adrenal glands and get inside the cell through the blood, the cell starts blocking themselves and don't take cortisol inside them. This is what we call as in cortisol resistance, just like insulin resistance. The question here is why cells do not take cortisol into them. This is because they became weak due to lifestyle issues like sleep deprivation or abnormal sleep, improper food intake. Cells lack that power to take cortisol inside them, so cortisol starts releasing glucose in blood. Just like when we eat food, glucose gets released into our bloodstream. In this way, cortisol starts releasing glucose into the bloodstream from liver as it is not getting absorbed by the cells. This glucose which is in our bloodstream will either go to the muscles to generate energy, and this energy is utilized in the form of flight and fight mode. Suppose sometimes we feel anxious to see a tiger or some animal and try to save ourselves, and our cortisol hormone will be high and it is released into the blood as glucose and gets deposited into the muscles and comes out as an energy and we get to save ourselves. If our glucose wants our insulin not to go on higher side, that is insulin spike, then it gets converted to fat and belly fat. So our cortisol hormone also tries to take glucose from everywhere from body. Even if glucose is not available from the liver, it starts taking protein which may be available in muscles like thigh, arm, etc. and break it down into sugars and convert it into fat. As a result, it leads to belly fat. So stress increased, protein or muscles tissues broken down, got converted to glucose. This glucose gets deposited as belly fat. The same cortisol was helping us in flight and fight mode, in insulin sensitivity, so that our blood glucose level does not spike suddenly. But when it won't get glucose from anywhere, then it starts taking glucose from protein, breaking it down and depositing it into the belly region, the midsection region, as belly fat. Now let us see the reasons why cortisol goes high. Any kind of excess stress causes the adrenal glands to increase cortisol production. Adrenal gland fatigue is a major cause of increase in cortisol hormone. Adrenal gland fatigue is thought to occur when the adrenal glands have been overworked to a degree that they can no longer secrete levels of cortisol that are adequate for optimal functions. Potential stressors include environmental and dietary influences as well as anxiety and emotional stresses. Experiences such as grief, trauma, and autoimmune conditions are considered to have a possible chronic negative impact on adrenal glands functions. An overuse of antibiotics is also believed to be possibly have detrimental effects on cortisol production. There are many reasons associated with this. Number one is sleep. Lack of sleep is another stressor on the body. By not getting enough sleep, your cortisol levels will rise and your adrenal glands will work overtime. More sleep will reduce cortisol and stabilize your adrenal levels. Second is caffeine. Coffee is one of the biggest culprits of adrenal fatigue as it causes your cortisol levels to rise, forcing your adrenal glands to pump out too much cortisol, leading to adrenal fatigue. Third is fresh air. Fresh air and walk in nature is also a great form of stress management and relief. Get out in nature, take a slow deep breath and relax. De-stress with exercise. De-stress with exercise. Besides changing your diet, one of the best stress busting strategy is to start exercising. Aerobic exercise boosts oxygen circulation and spur your body to make feel-good chemicals called endorphins. Aim for 30 minutes of aerobic exercise 3 to 4 times a week. If you're not active now, tell your healthcare provider you are going to start exercising. They will root out for you and make sure you are ready to get moving. Say no to high impact exercise. It's important to do low impact exercise when you're fighting adrenal fatigue. High impact exercise is another form of stress on the body. Make it harder for your adrenal glands to repair themselves. Consider doing cardio, light cardio or yoga. Drink half of your body weight. Hydration is very important for health of your endocrine system. So make sure you are consuming about half of your body weight in ounce of filtered water per day. If you're 150 pounds, for example, make sure you drink 75 ounces of water. Eat regular meals. Make sure you eat regular meals that includes complex carbs, healthy fats, and proteins throughout. It's important not to skip meals as that will also lead to adrenal stress. Also make sure you always eat your meals slowly. Do not rush through them. 8 meals within an hour after walking. Yes, eat your first meal within an hour after you wake up in the morning so that you do not allow your blood sugar levels to drop suddenly or instantly. Include protein in your diet. Protein such as organic turkey containing amino acids like tryptophan, which relaxes your body, contribute to less stress and reduce cortisol level, which help fight adrenal gland fatigue. Take vitamin B. Vitamin B such as B5 can help balance hormones and reverse symptoms of adrenal fatigue in the body. Consuming processed foods. Stress can come from many different ways, one of which is by eating too many processed foods, which will actually affect your body and give it a hard time. While processing, by removing them, you are supporting your adrenal glands returning to their natural state. Minerals like magnesium and magnesium-rich foods such as fatty fish, avocado, legumes and leafy green vegetables supports the health of your adrenal glands, balancing and hormone production levels and lessening the effects on adrenal fatigue. Consuming organic veggies. Organic green leafy vegetables as well as purple and orange veggies contain antioxidants, fiber and vitamin and minerals which contribute to the health of adrenal glands. So it's important to consume at least 6 servings of them in your diet. And lastly, meditate and relax. So stress is the biggest culprit of adrenal gland fatigue. So it's important to relax above anything else. Use some essential oils, take a slow and deep belly breaths and meditate to cause your stress level to drop off and your adrenal glands to heal themselves. So friends, I hope this video is informative to you all. We will surely meet again with another more informative video. Thank you.